dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about ticks, prevention, disease, and treatment. And my guests are Bobbie Bagley, who is the director and nurse for the Public Health Department. And along with her is Meredith Lockwook. Meredith is an environmental specialist with the Health Department. Ladies, welcome.
Thank you.
I'm delighted to have you here. So let's go right into it. What is it that we're looking for related to ticks?
Yes, so a major thing with ticks in this area specifically is Lyme disease. It's kind of a major topic people talk about. I think almost everyone knows someone that has been impacted by it. It's caused by one bacteria, Borrelia. It's transmitted only by one tick, so it's a black-legged deer tick. So every tick, of course, doesn't spread Lyme disease, just that one variety.
And there are many types of ticks out there.
Yes, many different types. It's really important for you to check for ticks. So if you remove them quickly within 24 hours, you're reducing your risk of Lyme significantly. So really those tick checks after you've come from outside is really important.
So would it be important to wear light-colored clothes when you go outside so that you can easily spot the ticks?
Yep, definitely. So where they are a dark color.
It's easier for them to hide.
Exactly. So if you have light colors, things like that, you'll be able to spot them easier.
Are there certain parts of the bodies that the ticks are attracted to enter in on?
So they enjoy kind of we always say behind the ears, they really like dark, moist places. So any kind of small crevice they can hide in, they're going to feel safest. So, behind the ears and in the hairline is a really common place. But aside from that, really anywhere where they can't jump or fly like a mosquito, what they do is they quest. So,
and when you say quest, what do you mean?
Yes. So what questing is they'll kind of attach to, let's say, a blade of grass and kind of have their legs just waiting for you to walk by.
So by your sneakers and your shoes and your socks are going to reach on right to your pants?
Yes, and then they'll kind of grab on. So, ankles, wherever you're dusting up against.
So that's important. As it gets warmer, people are wearing shorts. They may not have socks on, or they may be walking through the grass.
Yes. So here are some pictures of ticks. So you have the ones we start to worry about really are those nymphs. So that's at the stage that they're active, so they can bite you. They can transmit Lyme. They're also really small, so they're about the size of a poppy seed. So
when you say nymph, that's the little baby as soon as it's born.
So the larva is first.
Okay.
And then the nymph.
Okay.
So the larva is that first stage. They're not going to be biting. They're not going to transmit Lyme.
You see the larva? Can people detect that the ticks are ready to come out?
Those are going to be really small. Probably not able to find them. But the nymph, that's when. So the larva, it seems like maybe is about half the size of that nymph. Really? And the nymph is about the size of a poppy seed. Oh,
so you really have to look for them.
Yes. Yeah.
Yes.
And then the adults, though, also are transmitting, but they are still quite small, but a little bigger than that.
Are they basically the size that you're showing?
Yep, yeah,
Really
so that's the size of a dime.
Okay.
You see the dime in that corner. So they're quite small.
Okay, and that female one doesn't necessarily always look that red. They can be darker, so people
so where that's a drawing,
yes.
If it's black, it may still be. They can also be much more of a darker red, and really only in looking under a microscope would you see that red color.
So when they bite, how do they do it? They grab onto the skin.
Yeah, so unlike, comparing them again to a mosquito, because I think people are most familiar with them, a mosquito bites and flies away, and you're left with that. A tick bites and attaches. So if you just have a tick crawling on you, which I think probably everyone around here has experienced, it's quite an uncomfortable feeling if you notice it, if it's a larger tick. But it's not until they grab on that it's really the issue. So what they'll do is they want to grab on and they engorge themselves. So they want to get a lot of blood, and they'll get really big, and then they'll fall off. So you do have some time when, after it kind of gets on you, it'll walk around for a while and then grab on, and then it'll really attach and sink its head into you.
So what do you do? As soon as you see it, don't give it a chance to grab on,
Exactly,
right?
exactly.
And just brush it off or get rid of it?
So and it, if it hasn't attached, they're pretty easy. Yeah, you just can get them off. And but if not, if they're actually attached, there are tick spoons that you can use that really help. We have them at the health department. They're great tweezers. You want to make sure that you're not just, kind of carelessly ripping it off, where the head really does dig in. You want to get that whole tick, including the head.
So let's say you're outside playing a sport, and all of a sudden you notice there's a tick on you, and you don't have that tweezer, and you don't have that spoon. So what would be the best way to grab it to get it out so it doesn't attach?
I would say just being really careful to if you can get it off with your hands, it's not attached. So just getting it off.
Okay.
When you would need those tweezers.
When it's really attached.
When it's really in. The great thing about the tick spoons, though, they do have like a little hole in them. So a lot of people will put them on a keychain or a dog leash. So they really have them everywhere with them.
Are these tick spoons available like at local grocery stores or at CVS's and things like that? You said they were at the health department.
I know.
Can anybody stop in and get it? Or where can they get a tick spoon and put it on their keychain?
Yeah, we give them out at events, and we have them at the health department.
Okay, but if somebody is listening and not near a health department, where could they get it?
I know online you can get them. I want to say I would maybe some of your outdoor stores, things like that.
Okay, that'd be a good thing to have.
Yeah, definitely.
And from the time that they attach, how much time do you have before it can in fact impact your health and well-being?
So they really recommend within 24 hours. So it's that 24-hour window is really you want to get them off before that. So that's why it's important, when you're outside, coming back and just checking yourself for ticks.
And should people immediately contact their doctors if they have in fact been, it's attached and they've been bitten, to get treatment?
Yeah, I would definitely, if you have a tick that's been attached, if it's just crawling on you.
Right. No, we're talking about attached.
But attached, I would definitely at least call your doctor and see if they'd like to see you. Yeah.
Yes, and there are certain signs that people can be aware of that can happen after a tick bite, correct?
Yes.
So some of the signs that usually occur with the tick bite, where the tick bites you, you might have a red mark there. If it attaches, you might have a red mark. The sign that we want to look for an individual that may have been bitten by the deer tick is the bullseye rash. So on their, whichever area that the tick has bitten them on, there might be a red dot, and then there may be what we call a bullseye rash that may form around that site as well. They don't always have that bullseye, but if you have that, that's actually a telltale sign of Lyme disease. Some of the other symptoms that could occur will include like fever or headache, lymph nodes, swollen lymph nodes, joint aches, muscle aches. Sometimes there's pain as well. And so the reason why it's important for an individual, if they've had a tick attached to them, they want to make sure they call their doctor's office, is because they can tell them. You want to make sure, they may give them some advice to check for signs and symptoms of these types of signs, and then have them come in. They may start them on antibiotic treatment right away.
How quickly do these signs come about from the time that you are?
Well, usually with the bite itself, you might have a red spot right there, and the actual rash there may show up about a month or so later.
Really?
Yeah. So you want to look for those things there. The later symptoms can appear later on, or you might have some early symptoms like the red piece there. The muscle and joint aches may appear later as well.
Really? So that's why it's important, if you do get bitten, contact your physician right away, because you don't want to take a chance.
Right, exactly.
With these symptoms to come out later, you want to avoid having those symptoms. In the state of New Hampshire, do we have a lot of ticks? I know we have had a very dry season, and that we now have a moist season. So people are concerned that there are more ticks now than before.
Yep. So there's actually a 2-year life cycle on ticks. So one winter may not impact it. We may even be looking at 2 winters. So basically, in the spring, eggs are laid, and then the summer they become that larva state, and that's when they start feeding, and that's when they can first become infected if they're feeding on small rodents.
Yes.
And that's when and then it goes a full year to that next spring. That's then when they become the nymph.
So it's many months that
Exactly.
it's
So it's a 2-year cycle. So, we can't always say, a light winter means bad ticks.
Right.
But maybe 2 light winters may mean, a bad tick season. But moisture, last year was a relatively low tick season, and also Lyme then because of that. But of course, we were in quite a severe drought. So the ticks just weren't out. Where now, with our rain being back to normal, we're already seeing higher levels of Lyme and ticks.
Okay, and across the country, there are also in other states, all across the United States, ticks.
Yep. So ticks are around throughout. The Lyme specifically is really focused in the Northeast and the upper Midwest. So you see kind of this pocket in Minnesota and Wisconsin, and then really the Northeast, Pennsylvania and up. It's really, though, concentrated in the New England area. You have, I believe, when you look at the last 3 years, Maine has the highest rates of occurrence, Vermont right behind it, and then New Hampshire is right
So if you
there
look at
third.
that slide, the density of where you see the cases of Lyme,
Right.
pretty much right there in the Northeast in very dark areas.
The interesting thing, as you mentioned before, in the grass blades,
Mm-hmm.
but also I would think, besides grass, would it also be like in the forest when you're going on the paths or when you're
Yep.
bicycling? I mean, it can happen anywhere. By the beach also?
So the beach isn't an environment. It's really that wooded area.
Right.
Yeah. Beaches, they don't like even like wood chips and mulch. They don't like to walk over that. It's really that, moist grass that they like.
So what can we do for protection? Are there things that we need to do?
Yeah. So you can really protect your own lawn. So we always talk about, having a 3-foot wide border between, a lot of people have their yard and then they have, maybe a forest or a fair amount of trees and foliage behind their yard.
Yes.
So really at getting a 3-foot wide like mulch between the forest or, trees and your yard can really prevent ticks from getting on your yard. So they don't want to walk over that mulchy area. So that can really help. Other things are, just keeping up with your lawn. So removing brush and leaves and whatnot. Wood piles are another thing. So keeping those away from your house.
Okay.
But really the mulch and wood chips are really helpful, especially, if you have a play area, putting mulch around it. So then that whole area is protected.
Is there anything that can go on the grass itself? People treat their grass sometimes with fertilizer. I understand that there's some organic things that are out there that you could put on your grass.
I'm not sure specifically about different treatment for the actual grass itself,
areas.
but I'm sure there are different applicants that you can use. But there are definitely items you can put on yourself.
Like what?
So there's different, whether it be DEET. So they recommend at least a 20% DEET, or lemon of eucalyptus.
So for children, lemon of eucalyptus would be a
Yeah,
good thing.
maybe a safer option.
Would that be an essential oil that goes on, or is there a spray like that people can use?
I've seen it in the essential oil, but I believe they also have it in the spray. The EPA does have a great website that you can put in how many hours you're planning to be outside, what you're looking for protection, and it will tell you all of the different varieties.
What is that website?
Insect repellent. So it's cfpub.epa.gov
Okay.
/
Okay.
OPPREF /insect.
My goodness, they don't make it easy, do
No,
they?
they don't. So
My
hopefully we can get that link.
All right.
But it really is. It's a great resource. You don't overprotection doesn't help. You really want that target protection.
Okay, and that protection that you would put on you would be from head to toe?
Yep. So you don't want to be spraying on your face. It's important to, if you do need to put it on your face, spray it on your hands and put it. Other ones, there are other repellents that are just applied to your clothing, so you would never put it on your skin. The important thing is really to read those labels and to only use repellents that are, recommended from the EPA. The EPA does license those repellents, so it's really important not to go and buy, just something else. With insect repellent, you really should look for that EPA recommendation, and then just reading the recommendations that they give, whether it's to put it on your clothing. If it says put on your clothing, you certainly don't want to put it on your skin. But others may say, put on your skin and avoid your face. Others might say it's okay to apply to your face.
And that eucalyptus, lemon eucalyptus that you were talking about?
Yeah, and so that
can go anywhere.
Yep, and that is also that's regulated by the EPA, so
Very
it'll
good.
have the same recommendations.
Okay, so we talked about the ticks, what they look like, what to do, how to prevent them, related to making sure you do a good check.
Yes.
And sometimes you can't check behind yourself when you come
Right.
in. So that's where if you have a family member
Buddy.
that can check, or get a mirror,
Yeah.
right? And go to another mirror and look and see. But you also mentioned to take a shower as soon
Yes.
as you come in.
Yes. So if you've been out daily, these checks should be done daily.
Yes.
One of the main things that we want to emphasize is that we want people to be outdoors,
Right.
enjoying the outdoor weather, moving, because that's also very healthy as well.
Absolutely.
At the same time, taking those precautions, knowing that in New England we have ticks and we have Lyme. So every day when the kids come from outside, or if you've been outside in your garden, or if you have a pet that's been outside,
Yes,
do a tick
pets,
check.
surely.
Take a shower. Look in those areas where the ticks may hide, especially behind the ears, around the nape of the neck. They like to go in the axilla of the underarm and in the folds or in the groin area as
Really?
well.
Wow.
Sometimes in the back of the knee.
Yes.
And so, you want to do those things at least daily, because again, you don't want to have a tick on you for longer than 24 hours.
And I know from my animal's point of view, those ticks can really hide in that hair because
They
they have
do.
thick hair.
They do.
And so if you really don't look, and even if you do a quick comb look or whatever, you can miss it sometimes until they've already attached.
Right.
And for dogs, should you be contacting a vet right away if they've grabbed onto the dog?
So with the dog, you're probably going to find them quite frequently. I think the important thing with animals is really that you're checking very frequently with
And also
them.
the vets have the shots and
Yeah.
to prevent it for dogs, right? The
Yes,
Lyme
yes,
disease
they do
shots
have
and things
those.
like that they take. So what else do we want to make sure people know about related to this? There are other diseases than just Lyme disease that occur from the ticks. Is that correct?
Yeah, so we know that the Lyme disease is carried by the deer tick, and there are other ticks that carry other diseases as well. And I'll just give you just a couple of them. Ehrlichiosis is one. We have a slide that lists some of those. And this is another one that's usually found in the southeastern or the south central part of the United States. In addition, it's identified in a small number of patients that have traveled to different areas like in Minnesota or Wisconsin. Same symptoms, fever, headache, chills, malaise or muscle pain occurs with that. Babesia, which is another infection that can occur. And again, risk factors for this include other diseases that cause some impairment of the immune system. But these are also diseases that can be carried in the ticks as well. So again, these signs and symptoms are very, very similar. The key thing is to do the tick checks to make sure that they don't attach to you.
And if they do, to contact your doctor.
Contact your doctor.
Now, do you need a specialist or all family, general, internal medicine doctors can assist with this?
Your primary care doctor will be the person that you would get in contact with.
Okay.
And then again, they'll give some recommendations. They may have you watch. If the tick was attached for over 24 hours, they may start you on the antibiotic treatments earlier. Or if it's just been attached, they may want to start you on antibiotics. And so it depends on the physician or the clinician, but you want to make sure that you give them a call to make them aware of the fact that you had been exposed or been bitten by the tick.
And with the antibiotic treatment, that does help them related to that treatment?
The antibiotic treatment will help with some of the symptoms and help destroy some of the bacterial exposure that the tick exposes the individual to. And so the antibiotic treatment, depending on the physician, is a course of how long they'll be on that antibiotic. And so that's why you want to check in with the physician on that.
Okay.
You don't want to just take any antibiotic that you have around the house.
Well, this is why, we want to make sure of that.
You want to make sure, right.
You want to make sure you contact your physician, be seen. Do the physicians normally bring you right in to see you, or they determine what they need to do and then recommend the medical protocol for prescription medications?
So as far as them having you come in to be seen, I would think that they would want to see you before they just prescribed an antibiotic. The best thing to do would be to call, and the practitioner will give instructions on what needs to happen.
Okay, now what have we missed?
Let's see. I mean, I think we've gone over a lot. I mean, one important thing I guess to look at would be ticks in New Hampshire. So we've talked a lot about, Lyme, and I think people know about it, but how, your likelihood with black-legged ticks. So this graph, one thing that's or map that's misleading, the white doesn't mean zero, that ticks aren't infected by it. There's not enough available data. Okay. So really the entire state that they have available data for, of the ticks they've tested, between 40 and 60% are coming back infected with Lyme. And then
Really?
even higher in other counties. So Hillsborough County, where Nashua is, it's at 40 to 60%. So, the black-legged tick really is carrying Lyme, so, while not to scare people, but, the likelihood with this tick is there. However, of course, there are other ticks, so the dog tick, which isn't going to spread Lyme disease. That could also be a tick. So just because you have a tick on you doesn't always mean that it's that tick.
So you just really need to recognize this particular deer tick and what it looks like. And it's really amazing because it's that little baby dot that you really got to be careful of.
Right.
Yes.
Really, because they're the ones that get in there and you don't see them. And even that little one, it can attach and cause problems. People would think that, oh, maybe you need a bigger one to get the juices of the blood and swell up, but that little one can swell up too.
Exactly.
It's amazing. So for us to summarize a little bit about the most important things, I know you have a rate of Lyme disease by age. Tell us a little bit about that.
So I think one thing to also call to this one, it stops at 65. So it's not really showing the traditional curve that we think, affect really young and really old. It's really affecting the young and then the middle age. So
why do you assume that it wouldn't affect the older ones when they're outside and their lifestyle is active and they're...
Yeah, that's really what it comes down to. It doesn't have to do as much with age.
Well, I think that's an important point. If you're active and you're outside, which we want you to be healthy and well, you need to take particular precautions related to ticks.
Yes.
And those precautions are, what are the things that people need to do?
I would say first, wearing the right clothing. So...
And what's right clothing?
So not wearing dark clothing, wearing light clothing. Also, doing some maybe seeming silly things, but, sticking your pants, wearing long pants, but also sticking them into your socks.
Exactly. Pull those socks up. And so what if the socks are white?
Exactly.
So if you're going hiking, for instance, and you're going to be in the woods, that's a precaution that you would take.
Yes, you can wear your jeans. They may be a little dark, but they're thicker in material.
Right.
And then pull up those socks. What else?
Even tucking your shirt into your pants.
Right.
So,
Versus,
just, really cutting off all of those abilities for
entry.
Exactly.
But the hair and then in the ears and things like, so what about hats?
Yep. I mean, hats, we want to just, that helps too. And the sun, there are other benefits to that also.
Sure.
But really, it's where they're brushing against you.
Right.
So the legs are, arms are really the places that we're really concerned about with, even though they might hide in your, behind your ears, it's going to be a little harder since they don't jump, since, they quest. They, hold on to those little edges.
Yeah.
Okay.
So tucking the pants in, again, they're not, your pants aren't brushing up against the grass or the bushes because they're tucked in. So when they're trying to do all this questing,
They'll
there's
find
nothing.
somebody else instead of you. And as far as things to put on related to protection, you were talking about what for people to remember
Yes.
to get?
So either, you know, lemon of eucalyptus, DEET. It's really important, dependent on what activity you're doing. So we can't go and recommend, you know, one specific
Right.
repellent today.
Right.
It really matters what activity you're doing, who you are, what you prefer. But that EPA website, I would definitely recommend looking at.
Is there a website that you have with the health department that people can go to also for further information?
Yep. So NashuaNH.gov, that's the main city website, but you can find all of our Division of Public Health information on there also.
Is there a way for them to get those tick spoons too on the
Yes.
website?
They can actually come to the health department at 18 Mulberry Street.
Excellent.
Stop by our environmental health department. You'll meet Meredith there.
Okay.
You'll meet some of our other health specialists.
Yes.
But we do have the ticks there for people to pick those up as
Tick
well.
spoons. So other states and other areas that may be watching this show, they can also go to their health departments and get this information and also may be able to pick up these spoons?
They can get other information from either the health department or from the CDC, so www.cdc.gov.
Excellent.
Their state health department should have a website that they can look onto as well. Ours here in New Hampshire is www.dhhs.nh.state.gov. And then they may also have tick spoons that they have for people as well.
You can also purchase them online, you were saying?
Yes.
Yes, so someplace like Amazon may have that or other places may have
I'm
that.
sure some.
So the key here, ladies, from what you're saying is really be prepared.
Be prepared.
Be prepared.
Be
Enjoy
proactive.
being outside because you want to get that fresh air, but be proactive in what you do as far as what you wear, and be diligent about looking at your bodies to make sure that no ticks have gone on you. And then if you do happen to notice a tick, to get them off as quickly as possible and to notify your primary care provider if you've been bitten.
All right.
Right? And the website again is?
NashuaNH.gov.
Ladies, it's a pleasure to have you here. Thank you for everything that you do.
Thank you for
Until
inviting
next
us.
time.